Fertility Station. This is Bobo FM.
The views and opinions expressed by the following program and its participants are solely their own opinions and do not represent the opinions of DMS Broadcasting and have no affiliation to the BBC.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Do you have a healthcare question but not sure who to ask? Contact HSA's Patient Call Center to speak to one of our experienced clinical team members. We are here to answer your questions and help guide you through your healthcare journey. Need to make an appointment? Our team can help. Contact HSA at 949-8600 or email info@hsa.ky. At HSA, we are committed to caring for you.
All right, welcome to Bobo 103.1 FM. It's Dane hanging out with you. Next show, a new year, and we haven't done one of these since December 20th. So I am happy to have HSA back in the studios. Now, as we usually do every time we start the show, we want to remind you that if you have any questions at all, please feel free to use our social media. Very easy, Instagram, Facebook, Bobo 103.1 FM. Now, if I did not ask a particular question that you would like to ask our guest today, feel free to send it to us on our social media and we will make sure it gets into the right hands. Okay? Now, very special guests in the studios from HSA, Dr. Leroy Campbell, consultant and a doctor. I'll have him explain his specialty a little bit more before we jump into the topic today. Good afternoon, doctor.
Hey, Dane, how are you?
Doing well, sir. How's your new year so far?
It's been going great.
It's been good.
Going great. I'm happy, healthy, giving thanks.
Doctors are usually you're critical thinkers,
right?
So that means every year when we have a new year, are you writing down your goals, or are you kind of like winging it?
Hey, listen. Usually by December I have my goals figured out. By the end of December, it's funny. This year I'm still working on it, so I'm hoping by the end of January will be good.
I heard that it's a year that you should indeed take it slow. Like think about what you really, especially if you're at a certain age, think about what you really want to accomplish this year. And it's okay to make it small, like a very small list.
Absolutely.
Probably 2 things for the first quarter.
It's funny. I don't know if I'm aging, but I find that as I get older, the list gets shorter.
It does.
Yeah,
it does. Yes.
We have the shorter list that, okay, this is what I want to get done. 1, 2, 3, as opposed to 1 to 10, so maybe.
Indeed, you're right. I'm the same way. And you know what? I feel like I'm halfway there with the list that I have put together so far.
Good.
So talk to us, doctor, about your specialty and what you do at HSA and how long you've been there.
Okay. So my specialty is called Obstetrics and Gynaecology. Essentially, we're dealing with women's health. Mm-hmm. And so that's anywhere from menstrual health to menopausal health.
Yeah.
And of course we have pregnancy in the middle.
Yeah.
That's the obstetric part of it. I have been at HSA now, time flies, isn't it? It's actually about 3.5 years.
Oh, wow.
3.5 years. Originally from Jamaica.
Okay.
And I enjoy it. I now serve as the head of department there and trying to see how best we can make the services as excellent as possible for women here. And I'm enjoying that at the moment.
Yeah. You seem to love your job too. 3 years. Did you come in as head of department when you
No.
first came?
I have been serving now since June of last year.
So recent
capacity.
appointment.
Yeah.
Oh, amazing. Congratulations.
Thank you.
Definitely a critical thinker, like I said before, and a man that reaches after his goals. All right. So I think the first questions our guests would like to know is, what is cervical health and how important is it to maintain a good overall health?
Yeah. So first of all, we have to understand what the cervix is, right? And the cervix is really the neck of the womb. I call it the gateway to the womb.
Yeah.
Right. So essentially, it's the connection between the womb and the vagina, and it regulates what goes in, what comes out.
Yeah.
So it regulates menstrual flow. When a woman is pregnant, it maintains the baby until the time is right, and then it dilates to allow the baby to come.
Okay.
And it also regulates what goes in. So, for example, it blocks bacteria from going from the vagina to the womb. while still allowing sperm, for example, to go to the womb, to allow reproduction. So it's a very significant organ. It also has roles in terms of maintaining vaginal moisture and vaginal health overall.
Yeah.
So it's quite significant, but the thing about it, as it is with many significant things and people, is that it's quite silent.
Yeah.
And sometimes the most important things don't make much noise.
Yeah.
And it's the same for the cervix. So quite often you'll find that diseases of the cervix may not have any significant symptoms until it's quite late. And so for that reason, it's very important for women to pay attention to maintaining cervical health so that they can reduce the risk of these diseases, which can have significant implications for their health.
Dr. Leroy, is there anything small that you would say, you did say this is a very silent, obviously health part that women can experience, right? But is there anything small that you can say to yourself, man, if this is taking place right now, I should be a little bit concerned. Definitely should go get a checkup.
In terms of symptoms?
Yeah.
Yeah, absolutely. So for example, something as basic as having an abnormal vaginal discharge is very important. So the normal vaginal discharge tends to be thin, white or colorless, generally does not have an odor. If it does, it's not a foul odor.
Okay.
And is not associated with any unpleasant symptoms, right? So if you're having anything that's different from what I've just described, it's likely to be abnormal.
Yeah.
And in those cases, it's important to get that checked out because there are certain conditions such as an infection or even cancer of the cervix that can present in that way.
Yeah.
Abnormal bleeding as well is another symptom that needs to be checked out, especially if you're having bleeding after intercourse. That's quite often a sign of possible cervical disease, whether infection or malignancy. So we can go a little bit deeper into that if you want, but I'll leave it open to you to see how we flow.
It's first of all, like I said, I knew I was going to learn something today from this because this is a new topic for me. But I think one of the important questions to ask, because you mentioned something that it's one of those words that's very hard to hear, and cervical cancer. So we want to talk about cervical cancer here and how is that diagnosed?
Absolutely. I think it's a very important topic to talk about. It's one of the leading causes of death among women of African descent and certainly women in the developing world. It's funny because the truth is that if you think about the income stratification of countries, you're going to find that many of the countries, particularly in sub-Saharan Africa, are of low economic strength, right? And so the health services, the systems for healthcare are not as well developed.
Okay.
And you're going to find out as we talk a little bit more that screening, for example, is one of the key things in preventing cancer. So if you don't have a robust screening program, then you're going to have higher rates.
Yeah.
So that's one of the main reasons. So it's actually a statistic that is actually biased because of the financial implications around prevention of the disease. But when we talk about cervical cancer, the good news about cervical cancer is that it is one of those cancers that no woman has to have or die from in this day and age.
Yeah.
It's one of the greatest success stories. Yeah, absolutely. It's one of the greatest success stories in medical history, and at the same time can be one of the greatest tragedies.
Yeah.
Because we know it can almost, in all cases, be prevented, but unfortunately, there are women who are still being diagnosed with the disease.
Yeah. And do you think that's because of lack of screening, obviously, right? Women.
Primarily.
Yeah.
Primarily lack of screening. So because, as I told you before, the cervix is significant but silent, you will find that by the time you're having symptoms, then the disease may be actually quite advanced.
Oh, wow.
And so screening becomes critical. And screening just speaks to testing of some sort that is done before a disease becomes clinically evident.
Yeah.
Okay? And so most women will be familiar, for example, with the pap smear, or most men would have at least heard about the pap smear.
Yeah.
And the pap smear is one of the oldest screening tools for cervical cancer and is actually quite effective.
Yeah.
The science is simple. What it is doing is taking a sample of the cells that are falling from the cervix and testing them. Because we do know that there are changes that occur long before a woman develops cancer.
Yeah.
In actual fact, the evidence suggests that it may be at least 5, but as much as 15 years between the initial inciting factor, which is usually an infection with HPV, to actually developing cancer. So there are changes that are occurring, but because they're silent, you don't know.
Yeah.
But what the pap smear does is that it allows us to look at these cells under the microscope. And then the lab can say, well, doc, there are some changes here that are trending in the wrong direction. And that allows us, therefore, to provide further testing and treatment as necessary.
Yeah. Wow. And just to ask for any woman that's listening right now, because it may be a scary topic, especially when you talk silent. There are things that now at my age I'm thinking about, man, am I stressing myself out too much?
One of these days we're going to have a men's conversation.
Yeah, we need to, right?
I have something for you.
But I'm happy that we're on the women because we do have these conversations, doctor, all the time.
All the time.
Women take care of themselves better than men, especially
Absolutely.
Caribbean men.
That's one of the reasons I did gynecology in the first place.
Yes, because you thought that this was not going to be a field that you have to worry about, obviously getting consumers in or patients, we'd like to say. But
they actually follow your instructions. That's the reason.
Yeah, exactly.
They actually take your advice. That's the reason.
Women, we can't agree. We can't agree.
Absolutely.
Let me ask, though, the very important question right now that's on everybody's mind as they're listening to the radio. How often should they be getting screening?
Yeah, so before I go into the frequency, let's dig a little bit deeper into the screening modalities.
Okay.
So we spoke about the pap smear, which is a tried, tested, oldest screening tool, still effective. But we can also screen with actually testing directly for the HPV. HPV is just an abbreviation for the human papilloma virus.
Okay.
And that is the causative agent in almost all cases of cervical cancer or cervical cancer, right? Pronunciation varies, right?
Yeah.
So we can also test directly for the virus, okay? And so different regions will use different combinations of testing. Generally, it's accepted, certainly for women who are less than 30, that the pap smear is fine, usually once every 3 years at minimum.
Yeah.
Okay, so at minimum, you're going to be needing to do your pap smear once every 3 years.
Okay.
Obviously, if there are risk factors or there are abnormalities, then screening may be required much more frequently. And that has to now be individualized to the specific patient's concerns, right?
Yeah.
By the time women get to about 30 years of age, then in most centers internationally, the guidance would be to incorporate HPV screening. And if you add HPV to the screening, you can now even go as far as 5 years intervals in terms of screening. And that would make sense, right? Because remember I told you that it's going to take a minimum of 5 years to move from HPV infection to cancer, right?
Yeah.
It's 5 to 15 years.
Yeah.
So if you're HPV negative at this point, then it's highly unlikely that in the next 5 years you're going to contract the infection and then develop cancer. So that's the rationale for that 5-year window.
Absolutely.
Does that make sense?
Yeah, it does.
So here, fortunately for us here in the Cayman Islands and at HSA in particular, we have both the pap smear available as well as HPV testing.
Okay.
And so women can benefit from combined testing, which increases the pickup rate and the sensitivity of the screening.
Yeah.
Yeah.
So let me ask you this question, doctor. If a lady is to go in and she finds out that I do have HPV,
Yeah.
right? Of course, we know the automatic action that is going to be recommended is taking the vaccine. What role does that play? And do you have to take the vaccine? Maybe you're saying, no, you don't. Maybe there's a different alternative.
Yeah, that's an excellent question and a reasonable conclusion. It's a little bit more nuanced. I'll just help to explain it a little bit more.
Yeah.
So for those who may be wondering about the vaccine, so HPV vaccine, like most other vaccines, aims to build your immune response to a particular infection.
Yeah.
And essentially what a vaccine does is that it exposes your immune system to the infection in a weakened form or a form that's not going to cause you to have it, right? And then your immune system now is able to respond if you are exposed to the actual disease, right?
Yeah.
So if you imagine your immune system to be like a police force, then it's almost like showing the police officer a picture of a fugitive.
Yeah.
So that when the actual fugitive shows up, they know how to pick it up and how to deal with that fugitive. Does that make sense?
Yes, it does.
So that's what the HPV vaccine does. Now, the next thing to understand about the vaccine is that when we talk about HPV, there are many different strains of HPV. There are over 200 variants of the virus, right? Or strains of the virus. Of these strains, not all of them cause cancer. You understand? Some of them will cause things like genital warts and so forth, but not cancer. So there are probably about less than 20 that would cause cancer. These are the cancer causing, or you may hear them referred to as the high risk strains.
Yeah.
Okay. So for example, when we talk about testing for HPV, we're not testing for every single type of HPV. We're testing for the high risk or cancer causing types of HPV. Does that make sense?
It does make sense.
All right. So let's bring it back to the vaccines now. So for the vaccines, over the years, we have moved from having vaccines that cover for 2 of the HPV strains to 4, and now we have a vaccine that covers for up to 9 strains.
Oh wow!
Right, and that's useful. Fortunately, even when we're covering for 2, the 2 that we're covering for cause 70% of the cases.
Yeah.
But now we're covering for the strains that account for well over 90% of the cases. So most locations on island, including the HSA, will have now the Gardasil 9, which is the vaccine that covers for 9 strains.
Okay.
So cancer-causing strains as well as a few non-cancer causing strains. So it covers for genital warts as well.
Yeah.
So if you think about it now, then if we now understand how the vaccine works, then the ideal time to give the vaccine would be when? Before, right? You're exposed to the infection, right?
Absolutely.
And so that's the reason why most public health interventions seek to have the vaccine administered during the preteen or pre-adolescent age group prior to sexual exposure.
Yeah.
Prior to sexual debut. Does that make sense?
It does.
So that we increase the chance of protecting you or protecting our women and men too, we'll talk about that too, at a time before they are at risk of contracting the virus, because we know that HPV is most commonly transmitted sexually.
Yeah.
Right? Now, so we understand firstly that the best time is before. We also now need to understand that it does not mean that there is not a benefit to getting it after.
Yeah.
And nowadays we'll administer even up to 45 years of age to women who may want it.
Yeah.
And the reason is that, first of all, because there are different strains, even if, for example, you have been diagnosed, you've been found to have one strain, it would protect you against others, right? That makes sense, right?
Yeah.
And we've also found some evidence that suggests to us that if you already have a particular strain, it boosts your immune response to that strain.
Oh, wow. This is a lot of information to consume, but I will say to you, it's one of those that's very important. I think for me, not ashamed to say it, but I don't think I started to take my health serious until I was like 35, 38. And even at 38, 39, I became extreme about it with making sure I got checked up, because I noticed that prostate cancer runs in my family on my dad's side, obviously, right?
Right.
And one of the things that I noticed that took a while for me to do was the uncomfortable test. That's what I refer to it as. To me, not going to do that test at all under no circumstance.
I understand, right?
That was me. That was me. I was very strict about that. And I just remember how terrifying it was going to the doctor. I couldn't sleep the night before. Got to give women more props around this though, because
Absolutely.
they don't really care about the on being uncomfortable.
Mm-hmm.
They just want to make sure their health is in the forefront, right? But what I want to ask you, for the women that are uncomfortable,
Mm-hmm.
right, for any reason, I like to ask the question a lot of people are not asking.
Yeah,
right?
that's fine.
And this one, it's not that women don't want to come in and get checked up. You may be dating a man that finds it uncomfortable for you to get checked up by a next man. Can you speak,
Goodness.
just before we go into a quick commercial break, can you please speak to that relationship if you can, please?
Absolutely.
Because I see you as a professional, obviously.
Yes, absolutely.
But unfortunately, there are men out there that are not comfortable with
and
that.
I can understand that. I am a man. I'm married. I can understand that. I think one of the key things that people miss is that professional aspect of it.
Yeah.
Once you get into that mode, it's like doing any other job.
Yeah.
You're really, someone will look at you, for example, and they said, boy, I would be so nervous being on the radio, and being on TV and being in the spotlight. But once you get into that mode, you become someone else almost, right? You become your persona, right? And that's really what being professional is about. It's understanding the role that you're playing at that particular time.
Yeah.
And certainly for me, it really is. I understand their concern, but it has never really been a problem.
Yeah.
Because of that fact. It's about doing the job, serving the patient, and serving their best interest.
Yeah.
So I don't think if that's the fear, you have to worry too much. In fact, what it should encourage you to do is actually come along for the consult.
Yes.
And so you'll see exactly what I'm talking about.
They're invited into the room too,
Absolutely.
right? Absolutely. I love that. Listen to Dr. Leroy. He is joining us from HSA, having a remarkable conversation, life-saving conversation too. What you know will definitely help you for the future. We'll be right back after this quick commercial break.
Health Services Authority is now offering online payment options for patients. Patients of HSA can now pay their bills, including deposits, towards scheduled services online at payments.hsa.ky. The secure, new online payment system accepts debit or credit cards and is in addition to the available payment options of cash, check, and online bank transfer. For quick, easy, and secure payment directly from your phone or computer, visit HSA's new online payment system at payments.hsa.ky.
Welcome back to the show. It is Bobo, 103.1 FM. Dane hanging out with you. Thank you for being a part of the show today. Now we have a special guest in the studio, guys. The last time we have interviewed the superheroes behind the scenes that work at HSA, I think it was December 19th, just before we went on a break. But now we're back officially. This is all things HSA, whether they're having a conference, a doctor is speaking about his specialty, he or she, or maybe there is an area in HSA that was just launched that you have no idea about. Our job is to get that information out there. So it's all things HSA. If you have any questions, please use our Facebook, Instagram, and of course at Bobo 103.1 FM. Please help me to welcome Dr. Leroy Campbell here in the studio. It's a privilege to have him here in the studios. He spoke about earlier. He's been with HSA for 3 years now. Just recently got promoted in June. He's now head of department. I'll have him once again explain his specialty and his conversation today. Dr. Leroy.
Hey,
Yeah, so walk us through your specialty again.
Okay. So it's obstetrics and gynecology, but I like to just say women's health.
Yes.
Right? Women's health. It's a broad specialty, everywhere from menstrual health to menopausal health and everything in between.
Yeah.
It's really rewarding. I enjoy it, and I'm here to help you and to help the women of the Cayman Islands and those who are listening in the diaspora.
You're very good at it. I think you should.
Thanks,
Earlier
man.
behind the scenes, we were talking about you getting back into media and just doing some more stuff on the radio. I think this is definitely something you should explore more. Women's health is broad, so there's a lot of different discussions that you can have, right?
Absolutely.
So I think it's important to have conversations like this, and women love it too, right?
It's key. It's key. I enjoy it. I actually did a lot more in terms of public health education in the past. As we were talking about, especially after COVID.
Yeah.
That's when I realized, I started realizing, okay, you mean I could go online for free?
Yeah.
Because I do all these talks, but it's always in an academic setting to other physicians.
Yeah.
And then I realized that perhaps the focus needs to be more on the patients rather than the physician.
It does.
You empower the woman with the knowledge, and they'll know what to ask for.
Listen,
they'll know what to expect.
One of the things, and I'm sorry if I cut you off, Doctor.
That's fine.
One of the things that I am enjoying, and I wish I did earlier, but it's never too late, is seeking as much knowledge as possible, and not to say because I want to one day have an interest in that field or take on being a doctor one day. It's just knowledge is key. Yeah. Right. And I think that's going to lead us to our next question, because this one is a very important one. Laugh at me if you want, folks out there that's listening right now. But the day I found out through my dad and uncles, hey, you should get checked up. You know, prostate cancer has ran in our family. I've had it. I've beat it. My uncle, the only one, unfortunately, that passed away from this was my grandfather.
Sorry to hear that.
And it wasn't an easy death for my dad and my uncle to witness, right? But is it preventable? Absolutely. Again, screenings are very important for all the men that's listening out there. And also, this was quite funny. When I didn't want to do the test, I remember that there was a special smoothie that you can get at the trailer that says, helps to prevent prostate cancer. And as a man, when you read that, I was like, that's all I have to drink.
That, right?
I'm good. That's my superpower. But for those that live in the real world, bringing you back to reality,
absolutely.
How can women prevent cervical cancer the right way, not just by a smoothie?
Yeah. I think that's a very important question. I think there are different levels of prevention. Without going too much into the jargon, I'll break it down to the first of all, behavioral practices, things that you can control. So we know that HPV, for example, is a sexually transmitted infection. Yeah. And so we see a clear relationship between sexual practices and the risk related to cervical cancer. Yeah. So for example, the earlier the onset of coitarchy, meaning sexual debut, or earlier a woman starts having intercourse, the greater the risk. Yeah. The number of partners over time, the greater the risk. So we can start, first of all, in talking about safe sexual practices. And this is also important because the presence of other STDs, for example, HIV, actually compounds the risk. Yeah. So if you have HPV and HIV together, the risk of cervical cancer goes up quite significantly. So we can start, first of all, with behavioral practices to reduce HPV infection. And then we want to improve our immune health. Because of course, one of the things to note is that even for women who contract HPV, the majority of women will clear it. Yeah. So within 2 years, 90% of women will clear an HPV infection. Okay. But if your immune system is strong, and so having a robust, healthy immune system, so taking care of your health overall, managing your stress, exercising, getting adequate fresh air, more adequate water, make sure that you're having supplementation if you're not covering the vitamins and minerals in your diet. Yeah. These are key things. And of course, avoiding smoking, because smoking is pretty much linked to almost any cancer you can think of, right? It is. And cervical cancer is no different. So that's the first level. The next level of prevention is now screening. In fact, before I get to screening, vaccination. Yeah. Because as I mentioned before, long before a woman gets to the age where she is required to screen, you can be vaccinated. So this is where mothers, for example, fathers, for example, can ensure they're putting some measures in place to secure the future of their children, the little girls, for example, by ensuring that they're vaccinated with HPV vaccine before they become sexually active, right? And then we get to screening now. And when we talk about screening, we spoke about the pap smear, we spoke about HPV testing. And most places in the world would agree that screening should be women should start screening by at least 21 years of age, right? So, and then the frequency depends on the screening modality and what's found when you screen, okay? And that's something now you have to discuss now with your care provider, OBGYN, et cetera.
Yeah. So the treatment element of it, obviously, if you're told that, this is your reality now, how does the treatment look? Like, what are the treatments that these women have to prepare themselves for?
Yeah, good question. The first thing we should mention is that when we talk about treatment, we're looking at treatment of precancerous changes and we're looking at treatment of cancer.
Yeah.
If you recall, when we spoke before the break, that cervical cancer actually has changes that are occurring before the cancer develops. And that overall process takes 5 to 15 years, right? So our goal, for example, in doing a pap smear is to identify these precancerous changes.
Yeah.
So that we can then treat those changes and prevent the progression to cancer.
Yeah.
So when we talk about treatment, we must first talk about treatment of precancer, because that's really what we want to be treating.
Absolutely.
The goal is to be treating precancer, not cancer.
Yeah.
So if you do a screen, a lot of times women get very panicked if they have a pap smear that shows something or they come back HPV positive. But what I always say is, let's think about what would have been the case if you didn't come for screening.
Mm. Yeah.
This is exactly why we want you to come, because you're coming, we're finding something that I can treat that can ensure that you never have to worry about cancer of the cervix.
Yeah.
So that's the first thing. And typically, treatment of precancer is fairly straightforward. If it's caught early, we have simple procedures that allow us to destroy the abnormal cells and allow healthy cells to grow back. That's a basic principle. And then we talk about the cancer now. So God forbid we have someone who has either slipped through the cracks and perhaps not screened frequently, and we missed, and there was something that was missed. We didn't get the chance to pick it up before it becomes cancer. Then treatment involves one of three, or a combination of three modalities generally: surgery, chemotherapy, and radiotherapy. For cancers that are detected early, fortunately, most of those can be treated quite effectively by surgery with good expectation of cure.
Yeah.
If it's picked up early, which is once again why screening is so important.
Yeah.
For those that are more advanced, then surgery no longer becomes an option. And then we're looking at chemotherapy and radiotherapy for treatment in those cases.
Always what you don't want to hear.
You don't want to hear.
Yeah.
Yeah.
Yeah. And they always say that it, don't know how true it is, but you've always, I think everybody has someone in a friends or family circle that has gone through cancer treatment for whatever type of cancer it is. And they always say if they have to go through the radiation, it almost feels worse than the cancer itself. Yeah.
Yes, absolutely. It can be.
Yeah.
You feel that way.
Something we don't want to think about, but the reality of making sure that you go in as early as possible and get screening as early as possible. We did ask this question earlier, but we do want to bring it back again. For those that may be joining us for the first time, what are the most common signs and symptoms that may indicate that a cervical health problem does exist within you women? So we did bring it up earlier, but we knew we do have new listeners. So what would you say some of those early signs are that you probably need to go and get it checked out?
Yeah. Thanks for asking that again, because it's very important. And it's important for me to mention again the fact that the cervix, though significant, is often silent.
Yeah.
So that's the first thing, that you can have problems with no symptoms. Okay. The next thing is to really talk about the symptoms that you may have. And these would include, first of all, for example, an abnormal vaginal discharge.
Yeah.
Especially if you're having a discharge that has been treated with medically and it's not going away, it's recurring, then it's very important to ensure that there is some testing done and that this is not something that could be cancerous in the future. Or even a sexually transmitted infection.
Yeah.
Because when we talk about cervical health, we're kind of zooming in on cancer, but then there are other things that can happen, like infections, right?
Absolutely.
So abnormal vaginal discharge, abnormal bleeding, especially if you're having bleeding that's occurring outside of the periods, or you're having bleeding that's occurring after sexual intercourse, because it's indicating perhaps that there's something that's causing inflammation in the cervix, that the trauma of intercourse is triggering that bleeding.
Yeah.
Does that make sense?
Yeah, it does.
Yeah, so that's key. This is usually a very, very late sign, but pelvic pain. Pain in the lower abdomen, the pelvic area, especially if it's progressing, is also something that can be an indicator, but usually of advanced disease.
Yeah.
The truth is, I must also add a disclaimer to this, because the symptoms that I'm describing, though they can occur with cancer, in almost all cases, won't necessarily be cancer.
Yeah.
There are other things that can cause you to have an abnormal discharge that are far more common. There are other things that can cause abnormal bleeding that are far more common. There are other things that can cause pelvic pain that are far more common. So not because you're hearing us
talk about, because that was a very important
Yes.
point, because we know that women sometimes do go through discharge.
Yes.
And automatically you're listening to
We
this.
don't
It's
want
like,
you to think, oh my
like,
God,
you
we
have a
don't want-
lineup at the
exactly.
hospital.
We don't want you to panic to
Yes.
feel that. We want you
Yes.
to get it checked out, but please don't panic. Chances are it's not cancer. It just means that you have to get tested.
Yeah. Good point. Excellent point. Now, we also did mention this, but like I said before, new listeners on board, and we want to take that into consideration. But just how to avoid, obviously, ever having to hear that you may potentially have cervical cancer. Are there some things that you would recommend as a doctor? This is your lifestyle now. These are things that you should take on, especially if you're at this age. You should be looking to not smoke anymore or not eat this type of food, because this has been linked to this. Or we said it before, one of the most common thing is obviously, how sexual are you? Let's talk about it, right? What are some of the things that you just need to avoid? These are things that you need to say, no, this is a no in my life. I'm going to get my screening, but this could be linked also if I don't calm down on this.
Absolutely. I think, first of all, just trying to be the healthiest version of yourself.
Yeah.
That's going to be good for every disease you can think of.
Yeah, because you also mentioned exercise.
Yeah, eating right, exercising, avoiding toxic substances like smoking, managing your intake of these things is going to be key, right? Safe sexual practices, absolutely, because the link is clear. There's an association between high-risk behavior, whether early onset of sexual intercourse, multiple partners. So having protected sex is key.
Yeah.
Using a condom does not 100% prevent HPV, but it helps.
Yeah.
Okay?
Yeah.
It helps. And so if you are having intercourse, especially if it's outside of a monogamous relationship, you want to protect yourself. You want to be as safe as possible.
Absolutely.
Yeah.
And don't take anybody's word for it too, by the way. I'm fine. I'm okay.
You're okay.
Yeah,
That's
you
a
trust
good
me.
point. I'm glad you said that, because the truth is, remember that this HPV is almost always without symptoms.
Yeah.
Even in men,
Yeah.
it's there are no symptoms. And so someone may honestly be saying that they're fine.
Yeah.
They may not even be trying to deceive you. They may be fine, but they just didn't know. And it also, I need to make a clarification as well. I'm so happy you said that. Because HPV can sit latent for a long time.
Yeah.
And so,
How long are we talking? And the reason I'm bringing this up for you, a little bit of short story time.
Yeah,
There was
tell
a
me.
friend of mine, great guy. He
Yeah.
doesn't mind me telling the story. He
Don't call his name, though.
No, I will not. Never. He had actually, unfortunately, HPV, right?
Yeah.
Now, he's been married for 8 years.
Mm-hmm.
His wife thought he was cheating on him.
Ah,
That was
that's
hard.
exactly why I said that.
His wife thought he
important
was
for us.
cheating.
Yeah.
He wasn't.
Yeah.
Honest guy. This guy had to stay with me. He was in tears every day. He said, Dean, it would be easier for me to have dealt with this, what I'm going through right now, if I knew I did something
If he
wrong.
did something wrong.
But
Wow.
he didn't. Now, anyway, long story short, linked it back to an old relationship he had,
Yeah.
obviously.
Yeah.
But it led me to ask you that question. How long can this sit?
Listen,
dormant?
thank you for sharing that story,
Yeah.
because that's a very, very, very important point. And even as a physician, it's a challenge sometimes. It's one of the most uncomfortable parts of your job, but you have to do it,
Yeah.
because automatically the assumption is there infidelity here?
Yeah.
Why do I have this?
Yeah.
And the truth is that there are certain infections that can sit latent for years.
Yeah.
So you mentioned 8 years, even more, for a long time. Remember that cancer, I told you, it can take 15 years, right?
Oh, wow.
So the fact that it can take 15 years means that you can have an infection with HPV for over 15 years.
Yeah. Yeah.
You see what I'm saying? And so
worrying.
Right. So being positive for HPV does not necessarily mean infidelity. And there are other infections like that. So for example, HSV or herpes.
Yeah.
It's another one that can be problematic because the assumption is, oh, I'm having this. This was given to me by my current partner. But it's not necessarily the case.
Yeah.
So that's that. Thank you so much for that, because that's so very important.
It is
that we get that message out there.
It is, and I've heard stories like that, not only through my friend, but just in passing with people. When you do tell stories like it, you do have some men that have actually, unfortunately, had to go through thinking that they were. They stepped out of their marriage, but they didn't.
And women too.
Yes.
Yeah, because I've dealt with women. How do I tell my partner?
Yeah.
How do I explain this to him?
How do you help with that? Are you involved as a doctor at all with that and educating the relationship? I know you're not a counselor, but
I try to, because the education is always the key, right? People will do better if they know better. Sometimes, most of the time. So quite often, what I would say is, okay, let me do the talking. Bring the partner in, let's educate, and then we can answer the questions that he may have or she may have.
Yeah.
So that it's done in a healthy and a constructive way, as opposed to in a way that's devoid of that information. I think that's where the danger is. Ignorance creates much risk.
Well said. Well said. Next question here that we want to touch on is, how important is it for follow-up care after abnormal test results or cancer treatment?
Very, very important, because for a couple of reasons. One is that if there is an abnormal result, we need oftentimes to clarify. So for example, pap smear is a screening tool. So if it comes back positive, it says that there's a problem, but it doesn't necessarily tell us the severity of the problem.
Yeah.
So we need to do additional testing to see how severe it is, so that we can determine what the appropriate treatment modality is.
Okay.
Does that make sense?
Yeah, it does.
And then once you get the treatment, we must also have follow-up, because we want to know, is the treatment working?
Yeah.
Did it work? Did it achieve the objective?
Yeah,
because not
important.
because you had a treatment means that everything is clear. So we have to follow up, and oftentimes may require repeated smears at an earlier interval than usual. So absolutely important is that follow-up.
Yeah. You know what's hurtful too? Not the same type of cancer with someone I saw on Facebook recently, but I remember this young lady was celebrating when she received news that she was cancer-free.
Yeah.
Which we want to hear from any one of our friends or family members, if they were to ever hear the word cancer, at the day that they beat cancer. It's very important. Not even 4 days after her celebration. I think she celebrated here for a few days, went overseas, celebrated, started to have a pain in her stomach. And when she realized that she went back to the doctor, the cancer came back more aggressive. It's 4 days after celebration.
Yeah.
4 days.
Really sad.
How important is it that you urge women out there? Because we kind of spoke about that, but how important is it for women to, I would hate to say go back after 4 days of hearing that you're cancer-free, but can this return back?
Yeah.
Can cervical cancer return after being treated and you're free from it? Is there no freedom from it, or can it return if you're healed from it? I don't know. I think the question is, does anybody ever have to worry about, once hearing that word and they beat it, does it come back?
Yeah, I mean, it's a good point. So both precancer and cancer can return.
Yeah.
In the case of precancer, if you think about it, it can return because as long as the HPV virus is there, then the process can occur again. Okay. And in the case of cancer, similarly, because the treatment, all you need is, in theory, one cancer cell for cancer to potentially return. So you may have treated all the macroscopically visible, what you can see and what you can pick up with testing, but it doesn't mean that there aren't small quantities, microscopic quantities of cancer cells that, given time, can begin to multiply again or can spread to some other part of the body.
Yeah.
So that follow-up is important, and also You remember we spoke about that overall health? It's key.
Yeah, it is.
Because of the function that your immune system plays, and also the importance of other things like your diet and how that influences recurrence. So absolutely having that awareness. It's a little bit stressful, as you would imagine, to have this thing hanging over your head. But I think this conversation is key, because what it does is that it stimulates the idea that I have the power to prevent. So it's empowering to know that I can prevent, and also that there are options available for management. So not only can you get help yourself, you can also find help from others.
Absolutely.
And there are services there to do that.
Absolutely well said. That's a great statement to make. Very powerful conversation. If you're just joining us, Dr. Leroy Campbell is here, and he's talking about his specialty. We'll have this interview available, obviously, for you to hear again. It's not the only time that we're doing it. We're almost coming to the end of the show. We still got a couple more questions before we let the good doctor go. I think misconceptions is one that I want to touch on. Let's not play doctor. So let's have the doctor talk about some of the misconception, and that way anything that you may have that you may think or you may have heard in a complete different way, it's not so. It doesn't go that way. So Dr. Leroy, any misconception that you want to touch on?
Yeah, there are many, but I'll just stick to a few, probably 3 or 4.
Yeah.
So the first thing is that you can't have cancer if you're feeling fine. I think this is about the 4th time I'm going to say that. The cervix is significant, but it's silent.
Yep.
So it's quite possible to have cervical cancer and be otherwise healthy until it's quite advanced. So once again, importance of screening.
Yeah.
The other thing that's important is the concept that only old people.
Yeah, that's a big one. That is a huge one. It's no longer referred to as an old people.
Cancer is no, in fact, most of these diseases that we normally would have said, certainly when you and I were growing up, are old people's diseases.
You mentioned, we
high blood
talked about
pressure,
it all the time.
diabetes, all these things are younger and younger. So it's important to recognize that screening needs to start early. And remember, we mentioned as early as the age of 21 years old that women really should be looking to do cervical screening.
Yeah.
When I was in residency, we were talking about 18 years of age, or 2 years after onset of sexual intercourse. But now the guidance is generally a little more relaxed and said, okay, maybe 21 years of age.
Yeah.
Because of course, younger women have more robust immune systems, so they may clear it.
Yeah.
More effectively. The third, how many have gone? 2?
Yeah.
The third one I'd want to talk to mention is what we said before. The myth that if somebody is HPV positive, it means infidelity.
Yeah.
It doesn't. Guys, this virus can sit latent without any symptoms or signs for decades, a long time, for over a decade in some cases. So not because your partner comes back HPV positive, does it mean that that there is infidelity.
Yeah.
All right. So please don't go harming or hurting anyone.
Please, we beg of you.
Not on our account. We're trying to help, right?
No. Yes.
Okay. And the fourth one I'd probably say is probably about HPV vaccine, because I know we're living in an age of a lot of vaccine fear and distrust, especially coming out of COVID and stuff.
Yeah.
And there are many people who are turning down vaccines because they're afraid. And that's reasonable.
Yeah.
But vaccines, remember that the reason many of us can live as long as we do was because of vaccines in the first place.
Absolutely.
So we don't have diseases like smallpox and diphtheria and tetanus and all these things anymore. So vaccines are not evil. And HPV vaccine, fortunately, has been around now for some time. And we've gotten to be able to look at the evidence, and it seems to be very safe. And certainly the benefits seem to outweigh the risk.
Yeah.
And so I would encourage our women to consider that option and not be afraid.
And there's always a risk with everything too, right?
Absolutely.
But the less, the better.
So it's always a balance, right?
Yeah, absolutely.
Risk versus benefit.
Dr. Leroy, this has been an incredible conversation.
Yeah.
We
Appreciate
said
you.
but off air, we've said just how good you are at educating our listeners.
Thanks.
And hopefully this is
You're amazing too. It
Thank you.
just feels like we're just chatting over some coffee.
That's what it's about. That's what it's about. And I've always
You're
said I
great,
enjoy
man.
these segments.
Yeah.
I've spoken to Monique about it tons of times. This has definitely been one of my favorites and an important one to start off the year with. Also,
Absolutely.
women's health is extremely important. But this subject matter is also one that's I see why you guys picked this topic because, like you said, it's silent.
Yeah.
It's very silent, and we want to make sure that women are aware that there are diseases like this that exist. We want you to get early screening. That's so important. I think if the biggest takeaway from this conversation is early detection is extremely important. So
Absolutely.
if you're listening to the doctor right now, that is your sign. You need no other sign for what you heard today. Book an appointment. We want to make sure that he is overwhelmed in the next coming weeks, right? With the amount of patients that are going to be coming in just to simply check up. Doctor, we do have a lot of medical students that are listening to this program. We find we do get more messages from medical students or future
really?
medical students.
good.
Yeah, a
That's
lot of
good.
medical
Oh,
students
well,
usually
that's my
message. So
pleasure,
you
yeah.
didn't ask this question. Well, I'm not a doctor. I'm not a future doctor. But if you do have any questions, we always say, please just message us. We'll get it to Dr. Leroy.
Yes.
We promise you.
Yes.
But the most important one that we do get asked is, why didn't you ask the doctor what it took for him to get into this field? So we always ask for a brief 1 minute kind of explanation on what it takes for you to get into the field that you're currently in right now, starting from the beginnings to the end.
Medical school, being a doctor is a very protracted
I've heard.
profession. You have to be willing to suffer.
You have to love it for
You
sure.
know, I spent more of my life in this than I did outside, right?
Yeah.
So after medical school, you have to do a couple of years as an intern, and then we have different terms for it, but essentially an apprenticeship where you're working with physicians and you're learning in a hospital setting. And then after that, I was doing more of the family kind of general practice. But one of the things I noticed, as I alluded to earlier in our interview, was that I enjoyed seeing my female patients more than that.
Yes. They listen to
patients.
instructions.
They're motivated.
Yep.
They'll come. They'll get things checked out. They're very in tune with the conversation. They're less reserved in terms of expressing themselves.
Yeah.
So I really enjoyed that interaction.
Yeah.
And so that's the reason I eventually decided that I'd do obstetrics and gynecology. And the other thing about it is that it requires, in order to be a good OBGYN, you have to have a little bit of everything in terms of your package of knowledge.
Yeah.
Because you're going to have to, know a little bit of medicine, you are a surgeon.
Yeah.
You have to also care for pregnant women, so you have to understand a little bit about the developing fetus and a little bit about the pediatrics. So it's all sprinkled in,
Yeah.
all the different specialties. And that's really what appealed to me.